better sleep, sharper focus, a healthier life? It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Hi, everybody. We're going to welcome you to our podcast, No One Told Me, the Airway Health Connection. We have a special guest today, Melissa Mugno. Melissa, thank you for being here.
Oh, thank you so much. I love hanging out with you two. I feel it's always great to chat with you both.
It's so fun. It's like we're hanging out with our friends, right? Just talking about our most favorite passionate like topic and hanging out together.
We got to do your podcast. Can you tell us the name?
Mind Your Mouth podcast. You guys, yep, that episode's going to be launching in a couple weeks. Very exciting.
So we were just asking Melissa about all her favorite things like microphones and cameras, because we're really learning from some of the best. And so you guys should all give her podcast a listen. It's been so fun getting to know you over the years, Melissa, and I really value all that you bring to the space. And it's just so impactful, the things that you're doing. And I'd love to hear some more about your background. Like, how did you get started in myofunctional therapy? Where do you live? Tell us about you.
Yeah, well, that's great. That's always it's a fun little it's a comedy, also maybe a horror film. No, it's a mixture of all kinds. Yeah, so my background, I always tell people, is like in dental, whether I liked it or not. And it really did start as a patient in dentistry for so long. I kind of grew up with a fair amount of teeth issues, not orthodontic ones, but like actual, a lot of issues. I needed root canals when I was a child, and a lot of things I didn't know. And I was really lucky. I had a really amazing dentist, and I loved his team, and I remember his office manager. It was just like, it was a very warm and comforting place. I didn't know it at the time, but yeah, I really loved it there. And when I was in high school, I did not want to work at the mall. I wanted something different. I didn't want to have to like run into friends at high school. And my dad's neighbor was a dentist, and he gave me a job cleaning his office like after school and doing charts. And he was a really interesting cat. He was a perfectionist like I'd never seen. He actually made me clean around the chairs with a toothbrush and really clean. I mean, it was immaculate, hands down. But I learned a lot there. Started to learn the business of dentistry. And he had this really young associate that was like very cool, and I loved everything about him. And he was the first first dentist. He said to me, he goes, "You grind your teeth a lot. You should stop." And then just like, thanks, you know what I mean? And then it was like in my mind, but no one really ever told me how to fix it. And then I'm from New Jersey, and in New Jersey, you need an x-ray license. Like you can take a little course and you get your x-ray license. And so I went and did that, and I became a dental assistant in college and kind of worked some different ways there. I worked for an endodontist when I kind of got out. That was my big, like my first real like big job into it. And originally he didn't even hire me as an assistant. He hired me to bag instruments and put all the little files in his ring, right? In the endo. And
that's tedious.
It's very tedious.
But a very interesting happened. I do share my journey a lot, like my personal like triumphs and struggles. I'm an adult with ADD and ADHD. I was a child that was told that she had her days and nights mixed up. I was always told that, I was thick-headed and strong-willed, and I wasn't very willing to follow the rules per se, and that I was always like pushing the status quo. Like I just didn't make things easy. That's kind of what I was
I
told.
love that about you.
Thanks. Yeah, at the time it was, really hard. But one thing in middle school was I didn't I had a bit of a I get, we all have a journey, so I don't ever play the victim card, but yeah, I had some stuff going on at home, my mom was doing the best she could with what she had. And but I didn't know that I was struggling with insecurities and depressions in middle school on the level I was, but it was pretty intense. And then I was late to school all the time in high school, like just late every day. And it became such a point of contention because back then, truancy officers would come to your house. It was like, a really big deal. I know some kids, they're like, what are you talking about? I'm like, yeah, before COVID, like attendance was a really big deal.
Mm-hmm. Mm-hmm.
So if you were late to school, you were kind of labeled like a bad kid, you know what I mean? Like kind of a bad kid. And I would struggle those first couple periods of school. Like if I had math or I had history, I would do terrible those first subjects. Um, and so I bring that up because I was really struggling with sleep issues. I was struggling with very severe UARS, not knowing it, right? I was always tired, but during that time I was just being labeled, right? I was labeled of all of these things and it was really identifying who I was. But I'm born in 81, so ADD and ADHD didn't it was like my younger brother who's 87 who like they right away put him on Ritalin and all that stuff. I kind of got past that. They didn't put me on medication until high school, till later into high school. It was actually senior year. Um, and yeah, they gave me some stimulants and I was like, let's go.
Mm-hmm.
Um, but that created a bunch of other issues. And the interesting thing was I really still couldn't 100% sit still. I couldn't absorb information on the level that I wanted to. I had a want and a will like nobody could explain, but I really didn't know what to do with it because I was a little bit later. I was already 19, right? So a lot of these things had already been defined. So I got to college, and I'll tell you, I really swear that my high school guidance counselor told me that they didn't know what to do with me. They knew I wasn't dumb. They knew there was something off and they couldn't figure it out. So they didn't want to not graduate me because they didn't think keeping me in high school was going to benefit anybody. Right. Which I do. I'm grateful for that because I like some classes I was crushing it. I was cheerleader. I was part of certain things, but then yet I had this other side of me, which is very typical me. I have like this very multi-dimensional. And I get to college and I had a professor pretty much say to me, like, how are you even here? Like, there's certain things you don't know. And long and the short, that first semester really broke me. And I
I was just
decided to
gonna
take,
say, Melissa, like, I'm sorry to pause on
yeah,
that. Like, I don't mean to dwell on it, but like, high school is hard in the best of scenarios, just from the growing and the development that's happening in our brains at that age. Like, that is so much on your shoulders at such a young age. Like, I can't fathom that for you.
the level of fight or flight that I was in high school. I look back now and I've done a lot of inner child healing
So, do
and
you want to hug you?
oh
I just
yeah,
want
I
to
mean,
hug
like the
you.
things the good thing is I'm able to hug myself now and support myself, which is such a, and I'll share that a little bit, which is I give this airway world like I was saved and I had so many beautiful angels dropped into my world, and a lot of them have been dentists. And I didn't know it at the like, my journey is exactly what it needed to be. Yes, there was some really, you want to say tough situations, but it ultimately, if I could go back, I wouldn't change it because it
Yeah.
absolutely has made me who I am. And that's a really big thing for me to say because if you would have seen me, I know you too, 5, 6 years ago, I was working towards it, but I still was not 100% sure, but every decade has gotten better and better. My 40s have really been fabulous, have been like amazing. I really do. I always tell all my girlfriends, I'm like, 40s are great.
Can you imagine 50?
I can't, 50s, I'm
We're gonna
sure are even
explode.
better.
It's gonna be so good.
Yeah. But the best thing that happened, and I'm just to come full circle, was so I'm working for this endodontist, and he was perfectly crazy. It's only I've said this to his face, like absolutely on another level. His assistant walked out on him the second day I was working, and I'll never forget. He comes back. He looks like a mad scientist with his loops. Like didn't even take his loops off to find somebody, so he's like cross-eyed, and he comes in the back. And mind you, I also am still blown away that I was like using bleach to, like in the so I'm like all of these like I didn't realize what a stimulation I was going through. But he looks at me and he goes, "You have two hands, come with me." And I walk into this operatory, which by the way, he was a left-handed dentist that wouldn't pay for left-handed dental equipment. And we had everything was flip-flopped on the room. It was so right, the cords, but he's
Oh my
doing
God.
an apicoectomy. So the gingiva's flapped open. I walk in and I remember like, wow. I was so blown away. And I swear it was the most pivotal moment of my life because I'm such a visual learner. I saw the apex and I was like, no way. That's what a tooth looks like.
I love it.
It became the everything I learned. He taught me the tooth from the inside out, like like gutta percha. Like he taught me about X-ray. I learned so much from people that were on an extreme, like they were in such pain and discomfort. So learning that from such a like in a specialty setting was so amazing after that. And then I was still going to school. I was doing stuff, but I became obsessed. Like I loved it. And I was really good at it. It was repetitive. I understood it. But the one thing is I could really relate. I was able to like calm the patients down. Like I was always able to like just create this atmosphere. And I realized I had a good, I didn't know at the time, but recognizing that I had a gift of like being able to support people. And I learned how to communicate and explain a root canal in such layman's terms. By the time he walked in, the patient was laughing. They were almost looking forward to it. So I was taking this.
Can we hear it?
Oh, let's see if I can go back. So I used to make the joke about about gutta percha and how it was like, that they used it to fill golf balls. And I'm like, oh, you're making me think.
I didn't know
But
that.
it was, yeah. And that how it came from the sapodilic tree in Malaysia. And that like, honestly, it was just now I go back. I don't know if I would, you know what? I don't know if I would go back and explain root canals the way I used to, because now I'm not 100% sure I'm a big fan of them, but that's a whole other topic. But I remember saying to them, like, this is your body's way of sending off a signal so that we can protect you so you don't get infection. And I would be like like animated, but I would bring it to this like layman's terms. Like I was 20 years old and here I was this girl like, I mean, it's from this tree and like, and I would make it. And I remember he would say like he had a lot of anxiety, this particular dentist. He had his own mental health issues like all of us do. I used to joke that it was because of the fumes of opening up all the decayed teeth that made him a little nutty. But yeah, it was a really interesting time. And but then somehow or another I wanted to get a part-time job, so I ended up working for a pediatric dentist who had an orthodontist in there. And I was doing both at the same time. And the orthodontist there was another really big pivotal person. He was doing all of this early interceptive ortho with all removable appliances. Okay. Like CD distalizers, everything was removable. We put 4x2s on everybody, 6, 7. He was not doing it for airway. He was doing it for cosmetic. He would always say like, I want to make beautiful faces because people will come and work, like want, like they'll travel if I make their kids look great, right? He was not scared to talk about making really beautiful people. And working for these two different people at one time, learning it from the root canal side and then this really early intervention side, I was getting a very unique education that nobody else was, just because of who I was working with. And the one thing I say about both of them, here I was working with one dentist who was really struggling with depression and confidence. And then Dr. Joe Arve, the orthodontist, was the most confident, charismatic person I had ever met. And what he could do, like if your kid came in and you were to tell us that you lost your appliance, there was never a conversation. He would just look at you and he'd walk away, because he set the expectation up. Like, if you want your kid to be beautiful and you want this, you will do what I say. So I was learning human behavior in such a way, and it was all wrapped in this world of dentistry, that I really wanted to become a dentist, but I was never going to get through school. Like, I wasn't going to be able to get through dental school just because I didn't have, I thought I didn't have the discipline, or didn't have, couldn't memorize. That was the biggest issue. I couldn't absorb what I was reading. So I decided I was going to go to hygiene school. And I'm very honest, I hated every minute of it. And Dr. Arve fired me because I went to hygiene school. And he said he only hired the orthodontist. He only wanted people that were working with him that were going to be he was, he was developing a staff that were going to be with him long term. And he didn't want me. I had to make a decision. It was either do hygiene or stay with him. And, I went to hygiene and never really loved it. Did it because I thought that's what I needed to do. And one thing led to another. I met my husband, finished, but had this entrepreneurial spirit inside of me. And I thought, my husband's a little bit older than me. And I kind of left dentistry for a little while and started opening up businesses for some of my friends that couldn't get out of their own way. So I opened up an art school for one of my girlfriends who was an art,
That's
who had a
awesome.
master's in art. And we created art therapy as a business modality for M&M Mars. And then after that, did a Medi clinic for one of my girlfriends that was really ahead of the game of peptides and all of that stuff. And then my husband, in 2010, the market crashed. My husband worked for UBS and he lost his job. And so I had to go back to dentistry, and I went back, and a girlfriend of mine told me there was an orthodontist looking for a hygienist to run his practice. And I was like, that is the oddest thing I've ever heard. But me and Mike met, and he was exactly who I needed to meet. He was this entrepreneur orthodontist that he told me, he's like, I became a doctor because my dad's a neonatologist and I'm Jewish and you have to be a doctor. Like, he goes, so I became I became an orthodontist, but we would spend half of our time thinking about building food trucks outside the dental office. And he gave me this canvas of ability of taking business development and airway, and it wasn't airway at the time, but dentistry and entrepreneurship, and bring it together. And that's what brings me to airway. We had the coolest offices. We ended up having 4 practices. We were building these really sought out patient experiences. And we both had kids, and his dad, who's the neonatologist, invites us to this dinner, and we meet these lactation consultants. Mike's wife was a pediatric dentist, and that was the first time I ever heard anything about tongue ties. And his dad proceeds to tell us that, what was it, like 91% of premature babies can't latch properly because of all these aspects of coming into the world. And that his dad made a comment, I think there's some correlation to function and the things you guys are doing. And we went back to the office the next couple weeks later, ended up at Barry Rayfield's office, who was a myobrace doctor at the time. And that was the first course. That was 2011. And I remember in that course, I didn't understand what the heck they were talking about per se. The logistics were a little weird for me. But I remember listening to Barry and this other guy, Rohan Wijay, Dr. Rohan Vijay, and they were showing kids that don't sleep, kids that grind, kids that breathe. And all of a sudden, I start like tearing up, and I don't even know why. And I'll never forget. Mike's a funny guy, and he looks at me and goes, "What the hell? What's wrong with you?" I go, "I think this is me." And he goes, "Well, that would explain a lot." Like, you know what I mean? Like, we had this moment, and I'll never forget. They put up a class 3 bite, and Dr. Mike Skolnick stands up and he goes, pretty much says, "Bullshit." He goes, "Listen," he goes, "if that appliance can do it, she can sell it." He goes, "All right, we'll buy your little system and we're going to get out of here because it's like a summer weekend." He goes, "Because she can do it." And I was like, "What am I doing?"
What?
And we went back, and I think I sold 200 cases of MyoBrace, and they were all failing. And Mike looked at me and goes, "You better figure out what we just got ourselves into." That got me on a plane out to Denver, knocking on Sandy Colson's door, pretty much, because I found out Sandy Colson was the one that developed these exercises for MyoBrace. And Mike pretty much said to me, "You better figure out how we're going to get ourselves out of this."
The queen, the
The
queen.
queen. And Sandy looked at me, and I'll never forget. I go, I had called her obviously before I got there, but Sandy's like, "Chris Farrell told you you could do it without a good something." You know, she made some comment. She goes, "Sure, come on out here. I'll show you how to do it the right way." And I end up at Sandy, and she lets me 2 days. She lets me just hang out with her. And she said, "Do you want to be a therapist?" I said, "No, I want to figure out how to implement this thing, because if not, we're going to like, this is a really big issue." She goes, "Well, the only way I can teach you is to teach you what the therapy is so that you can then go learn." So I never actually set out to be a therapist.
Mhm.
I only learned the exercises to bring it back to the office to then figure out how to navigate out of it. And then I ended up, I guess, becoming a therapist because Sandy's like, sent me a certificate, said that I went through the Colson Institute. And yeah, one thing led to another, went back to that office. We fixed it. But at that point, Mike had decided his business plans were going to go on to build these bigger dental offices. And he said to me, I'll never forget when he said it. He goes, "I don't think there's money in Airway." He goes, "I don't mean it to be rude." He goes, "And I'm not, I mean, we could go into depths." I looked at him. I said, "What do you mean?" I said, "Come on, this is really cool stuff." I didn't realize that when I cried that day, my inner child was woken up, and I could never go back and look at the other way. Mike, by far, is first person that believed in me, trusted in me, let me build, do all kinds of things. The hardest thing I ever did was when I went to him and told him I was going to leave, told my husband I was leaving. And I promise you, I say this, I mean, I had literally like a lot of people that thought I'd lost my mind, which maybe I did, because I had a great job. I was making a lot of money for my family, and I was very well loved and respected, but I no longer could be in a line to what Mike was doing. Like, I no longer, we weren't on the same path, and
You
I
can't
didn't,
unsee it.
I couldn't. And then long or the short, MyoBrace offered, because MyoBrace heard how many appliances I was selling. MyoBrace offered me a job to be to do sales and VP on the East Coast. Best business move I made was that I decided I didn't want to work for MyoBrace, so I opened a firm, and they became my first client. So that's how I ended up doing what I did. And I spent the next 3 or 4 years. I did a year with MyoBrace and realized I didn't want to sell MyoBrace appliances. And Sandy Colson, again, come back to Sandy. Calls me and goes, "You should be the cleanup committee for all the doctors that implement this and then mess it up." And then she got me my first consulting job with Karen Foster in Denver.
So for anyone that's listening that doesn't know the names, the story
Okay.
itself is so colorful and wonderful, but like we got to pause on Sandy, right? Like I think we need to pause and talk about who this woman is and why we're smiling when you say this name, and like Liz is referencing the queen. Can you explain a little bit about how she has been influential in this space?
Well, let's talk about Sandy's background first of all. So Sandy
Yeah.
Colson is a speech therapist who is married. I think I don't know. Maybe Liz, you might know. I don't know if he's still alive, if he passed or not. But her husband was
He's,
is an orthodontist.
I believe so.
Okay, yeah. Well, he was an orthodontist. I know he's an orthodontist. Whether he's he was an orthodontist, he's retired at least.
He's he's in his 90s.
Yeah, he's in his 90s. So Sandy was speech, he's ortho, and they were doing ortho and myo in the 70s together, like late 60s, early 70s. And Sandy was, to me, one of, I honestly, I think she was even before Joy Muller. For some of you guys don't know, these are like the OG goats.
The originals.
Originals. Barbara Green might have been around the same time with, I think Sandy's older than them. And her and her husband, and I think this is what separates Sandy from the others, and I say this with grace, Sandy was always working in the structural space because of her husband in the orthodontics, right? Mm-hmm. So they were doing things in this collective measure of ortho and therapy. And Sandy, any of you guys don't know her, she is a force to be reckoned with. She just has this energy and this vibrance that is electrifying. And I think she could see things and communicate ways that was just precise and just with conviction that you just couldn't. And she cares so much. This level of caring was, just abundant. You couldn't not see it.
She came to my office one day. She loves lips. And so her whole office was decorated with big red lips. And so was her license plate. And she strolls into the office and we're sitting there talking and she just goes, Liz, I'm going to die one day. I hope I don't fall on a kid because I'm going to die working. And I was like, oh, I respect that so much. She just loves what she does. Yes. And I just looked it up. She graduated from speech therapy school in 1965. Like she's been doing this a long time. Yeah. She's now retired. And I mean, in terms of our community in Denver, I think that's one reason that people are so open to looking at functional therapy because we have had that as a baseline here as our community for so long. So I feel so grateful to be in the same town.
And somebody that's not in your community and hasn't had the pleasure of meeting this OG, like badass therapist, I think that what she and her husband created is what we all know, right? You cannot separate out structure. Mm-hmm. You cannot separate out behavior. You cannot separate out function. They have to be looked at collectively. And I think that that's why this is so cool that this is your journey because you got that so early on.
Which it goes back to like where now when I look at my journey, like how you couldn't recreate it. Like there was a higher force putting me in front of all of like Sandy, if I was taught by anybody else, it never would have clicked because I needed the orthodontic component because that's how I see, right? Like I go back and I want to explain and I say to people, I might not be the best therapist or whatever, but I know the teeth and I know how that tongue affects the teeth. And because I'm such a visual learner, when I'm looking in someone's mouth, they've always made sense to me, right? So I see them as like a unit. They're not separate. They're like, it's all one. The mouth is this beautiful window into the body. And when you're able to unravel like you ladies and see it from this other perspective, you can't really see it from another place. And Sandy would talk to me about the tongue and all of that aspect. And then we would like drop right into the teeth, right? So they were best friends, like peanut butter and jelly, like I called you two. Yeah. They complement each other so well that they're better together, all of these things. And being able to talk to her, and then for your listeners to know, the company MyoBrace, which is this prefabricated appliance, and people always say to me like, "What are your thoughts on it?" And I say, "I love all tools. I'm a fan of tools. I like gadgets, so I don't think there's ever one that's perfect. I think you need a box of tools. But if you go back in history, and we always have so much to learn from history, Chris Farrell, who's the owner of MyoBrace, he went to Sandy. Him and Sandy were the original duo training on therapy with John Flutter and Mew talking about structure, function, and behavior. And like everything, we're all trying to make systems and make things better for people because humans need systems. There's nothing bad with systems. I always try to tell people like you need repeatable processes. It's the way we thrive. It's how we get comfortable. It's how you build trust. So I have never have anything but like admiration, and I'm so grateful for every company or person I've been able to spend time with, because you got to learn from them taking chances, right? Like it's you don't know what you don't know. And my time with MyoBrace, instrumental in where I'm at today, because I learned what not to do. I learned what to do. I spent so much time, and being able to spend a year, 2 years working with these different cases and then going to all these different offices throughout the country and learning different groups of people, population. So at one time of my career, I think 2015, 16, and 17, 3 days a month I'm in Denver. 2 days a month I'm on the north side of Las Vegas, which is a very different population and group of people. Then I'm down in Florida, in New York, and in Texas. Like seeing patients from all these different aspects and then watching these offices have triumphs and struggles. And being able to see that, I have such gratitude, for all of those aspects, because I think that's what makes me a little unique in the space.
Well, and that's kind of what we think about too from a restorative dentistry perspective. Like we're kind of the same thing, only on the dentist side. It's if you see all of the age groups and you have an understanding of how that structure function relates all the way through, it gives you a bigger picture and kind of more experience to pull from. You should have been a dentist, but I'm also glad you're not, because you never would have you would have had an impact, but the impact you've had on the space you're in has been so tremendous, and you can't duplicate a personality. Like your personality and your drive is what got you where you are, and it's what's created such an incredible thing.
We talk about
Which I
ripple.
really appreciate you saying that. And I do want to pay homage. I know you guys were just with her, so Sarah Hornsby, who has become a bit of my partner in the therapy space and a lot of things. And what I loved about her was, because I am me and I didn't always follow the rules and I asked a lot of questions and I talked too much, or I would just kind of beat to my own drum, or I would try things out. I was not always as classy as, say, the dental space wanted me to be. For Sarah, and if any of you guys don't know, Sarah Hornsby is very classy. She can play the role. She knows how to articulate in a way that's very soothing and digestible. But yet she knew, she wasn't scared to like not only bring me in, but then also bring me onto faculty and let me bring this complete contrast and like really stir things up to create a different way of thinking. Where I will say, I do think a lot of other training groups or different groups really struggle with that, because they worry about being accepted or not wanting to be canceled and all that aspect, which I totally understand. We all have a lot invested in this, but I appreciate people willing to take a little bit of chance of getting comfortable being uncomfortable. I think that's what we loved about Zoggy, right? He was the first one to go out and say, here's what I learned, and then here's how I got better. I wouldn't redo this or something like that. I think that's where I'm grateful in this space that people that are willing to
Well,
to
I think
push.
that in this genre of treatment, right? Like we all have we're all early enough adopters. We're later than some of you, but like we're still early enough adopters that we've had to kind of do this without a really clear roadmap, right? We're grabbing pieces, we're pulling it together, we're seeing what sticks, we're figuring out how to make it work within whatever realm we're working, whether it's myofunctional therapy, orthodontics, general dentistry. Um, and I think that this is a really important message for all providers, and also a really important message for all patients, that you cannot tease out the complexity of this. And I think that as an early on provider, I was looking for that magic bullet, the same way that you guys were looking for it when you found MyoBrace, the same way I was when I found tongue ties. Like we're all looking for that one thing that is the crux. And now looking back at it, It's just not that simple. Our bodies are so integrated with all the parts that you really have to zoom way out and understand how each part impacts the other systems, and then decide where do you need to jump in for your own personal journey or your child's personal journey. But I think that's the most robust thing to look at, is all of these people that are trying to scrappily put it together had to learn the hard way that it's not just one thing.
Yeah, we're so multifactorial. Like even you talking about like your mental health journey along the way. Like how many of the kids, myself included, do we treat that are also going through a lot of things that are beyond structure? But the structure plays a role. Like all of these pieces go together and we control what we can control. We can control structure at times in a more rapid and effective fashion, then we can control other things like a home life and nurturing environment, things like that. So, you know, we don't have a magic bullet for health, but we have all of the little things that add up and make us a better version of ourselves.
Well, for me, the mental health aspect was I was trapped in my own mind. Like my monkey brain was, just this continuous loop of even 5 steps forward, 4 steps back. I was self-sabotaging in a way I didn't even understand. And I was on pharmaceuticals, Lexapro, Adderall, then drinking a glass of wine at night to come off of it and to try to just manage my own feelings inside of me. But the one thing that I realized that I couldn't just do and do easy was breathe.
Mhm.
And it's not that I wasn't functioning. I was walking, my organs are getting enough air, but there wasn't enough left over from my mind. There wasn't enough left over for me to quench my central nervous system. And with that, without the ability to, when I say breathe, like that quenching of all of your tissues, of dropping into your body and expanding on a level that allows you to find some type of peace was, I mean, foreign, like didn't even think it was something possible. My clenching, my grinding, it was all my body's way of protecting very simple things of me not being able to truly breathe.
Mhm.
And that does come from environmental, like my mother, my grandmother. I mean, I could see it in multiple. All of the women in my life were doing the best they could with what they had. Nobody was doing anything with malice, but no one knew also how to fix it. Naturally we deflect. We want to. It was easier for my mother. I'll never forget when my brother was really having behavioral issues. I don't say this to shun her or make her feel bad, but I know she felt a relief when they told her my brother had ADD because it made her feel like it wasn't her fault. It was something wrong or like he had a diagnosis and there was going to be a magic pill. And that pill did not fix him. That pill numbed him. And that numbed him from his feelings. The Where I think I benefited is that they didn't give it to me till later on. So I had to feel all those feelings. Again, I had to feel it out. My brother, till this day, in his late 30s, is really trying to adapt and figure out how to live within his own feelings, right? And I think a lot of us as adults are struggling. And then when our kids are doing this, and all I keep coming back to is just teaching people to screen and giving a little bit of tools for sleep hygiene and breathing is really the first step of just giving people something to get started on, right?
Yeah.
Like it's a big deal.
I'm finishing up a great book called Scattered Minds.
Oh, I'm reading it too right
It's
now.
so good.
It's
So I
so
just got
funny.
to, like, I just saved a clip in the parking lot talking about how we control the things that we can control with the tools that we have. And also that even for something like mental health, there's no quick fix. And the hard part is, unless it's padding a pocket of a pharmaceutical company, there's not as much of a motivation for prevention because there's not a lot to gain. And if we think about some of the business acumen behind even dental modalities, dental companies, if we can prevent stuff from happening, that doesn't necessarily help them when we prevent problems from showing up later. But man, that book's fascinating. I would love to. We should try to get him on like a joint podcast.
Good.
Because like yesterday when I got out of the car and I didn't shut the door, and my husband was like, "You gonna shut that?" And I was like, "Well, like my brain's a little busy right now. It doesn't have time to shut the door. It's doing all the other things it needs to do." But I think there's a huge structural component that's missed in that book, and not because it was neglected to be put in there. It's because we don't talk about it in relationship to oxygenation of the young brain and the adult brain, and how that impacts all of the other behavioral things too. So that would be
And
so fun if we could
it
thank
would.
Gabor Mate if you're listening to this.
Yes, please. You know, the thing of it is that I always say, like, the beauty of these of our teeth is that it's our body's way of highlighting dysfunction, right? Like, it's showing you there's something to take a look at. As long as you know what to look at, what to highlight, right? And that's really what I've been really spending this thing, is I think of like, when we started being able to, like, sealants and all these things to try to decrease. But if we can just talk about highlighting, that dysfunction is not, it's not bad. We're not judging you. You know what I mean? It's not, there's no magic pill. It's okay. But I think it brings back to human behavior is such a intense conversation. And I think a lot of dentists, especially, it feels awkward sometimes talking about it in a dental office. You don't want to upset people. You know what I mean? It's hard to implement it in a way to add that human component onto it, even though you guys already have a human component with behavior modification. And the thing with airway is, and I think you both can you can testify to this, is that it almost feels a bit like a side hustle. Like, you know what I mean? When you're first putting it in, it feels like it really is like almost like a new business, like an entrepreneurship. It's not this very systematic teaching thing of dentistry. And, one area I really try to open up and lean into is that needing to make money is not bad. Like, I feel like it's really important we say that. Like, money's energy, right? We all need it. No, it's not bad or good. It's actually neither. It's just is what it is. As long as you're doing whatever you're doing with that energy is with good intention, right? And you're putting it to the right things. But a lot of us have very personal connections connected to money from our lineage, from our family, what we were ever brought with. And because of that, a lot of our decisions are wrapped up into this. And a lot of times we don't want to address it or see it. And therefore that affects the way we do business, how we handle things, who we hire, how we spend, all these aspects. And I think it's very interraveled or intertwined into everything we do. And I don't know. That's a little bit of my mission.
When you say like the side hustle, you're right. It does kind of feel that way when you're thinking about implementing some of these things. But, I've learned that that's the worst way you can look at it, because you're going to
separate
take
it out.
something that's new and different, and you're going to be uncomfortable in having those conversations when it should be exactly that. It should be a conversation. Like, I just tell people, like, one question on your health history form: are you concerned about your sleep quality? Are you concerned that your teeth are crowded? Like, a question like that can trigger a whole list of question and answers between a patient and a provider that nobody else has ever brought to their attention. So it just doesn't have to be as hard as we want to make it. Yes, the details, the nuances, collaboration between different providers, like that stuff takes time to build and understand. But just assessing for structure and thinking about it a little bit differently is the best way to start.
Yeah,
Just what do we say? Area aware, just being area aware, like just being mindful of it.
which is one of the biggest, but even being airway aware seems foreign to so many people, right? And
For
again,
sure.
It's this conversation of how, when, and why, right? Like, how do I implement? And I mean, we could go down these rabbit holes. When I go into these offices, 99% of the time, they'll tell me, oh, I'm having an issue screening for tongue ties, but then you go in and they're having much deeper issues on a much, from a foundational level, whether it's because the leader, there's leadership issues, there's, they're having turnover rate. There's a lot of things. When you start to change something, it exposes you. It makes you vulnerable because you have to start looking inward, right? You have to look inward. You have to get really clear what you want, how you want it, so that you can build something that's really great. And I think, like all small businesses in the beginning, right? It's like survival in the first couple years. You know what I mean? You get out, you're doing something, you got a repeatable, you run through it, and then now all of a sudden you got to start looking at, like, what kind of leader am I? How do I develop teams? How do I build a culture that I like? What type, who do I want to be in the world? Legacy, all that aspects. These are really big conversations that I don't know how many dentists, whether, and maybe medical doctors in business in general, really sit down and look at themselves.
None.
And I think airway exposes internal insecurity. Like, I think there's something about it that opens up. I don't know if how you two feel about that.
Well,
Well,
you're saying right now,
we both would say we're unfulfilled in our careers. Like, we're both striving for perfection and doing everything we could. Like, we're in two kind of different types of practices, but both of us were always looking for better, 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 better. And it wasn't until we stumbled upon this space where it was like, oh, wait a minute. And so, yeah, I do. I think you're right. It does kind of expose this internal of, like, how else can I help? How else can I do better for my own fulfillment in my career, for our patients in front of us, for businesses? There's a lot that goes into it beyond just being like, oh, I think I saw a tongue tie.
well, I think that also, I'm so glad you brought that up, because the way you just explained it is the most clear I have felt about this, as far as why it's so hard. And for a long time, at the beginning, you need a team around you. And I was like banging down doors, and I was like shoving airway down people's throats, like patients and providers. And I was so mad. I had such a chip on my shoulder about why are my colleagues not implementing this? Why are they not seeing what I'm seeing and also as passionate about this as I am? Like, how dare they? And now, on the flip side, looking back again, like, it was a huge shift in not only my mindset, but in the way we practiced, how we implemented it, how we diagnosed, how we talked. And that's not an easy thing to do on a dime. That is not something to do because another colleague is excited about it. You have to have that personal connection and a want to do things and see things differently.
And the support, as I'm sitting here, I'm thinking, just lowing, like, all of a sudden, Liz, you're talking about your husband, and then I think of Meggie. Like, you both, and I do as well, have very wonderful partners, right? Like, really strong people that have been able to help you guys navigate. I mean, sometimes I didn't even realize what a support Joe has been to let me do this.
Yeah, they believe
I
in us,
took it
which
for
is like
granted.
rare.
Yeah, like, I can travel and he's watching, Joe's away this week, and I'm like, our kids do this many sports? Like, hold on. I'm like, wow, okay.
Dan's gone right now too, and I said, you feed them this many times a day. You just
Yeah, I
keep
know.
you just keep feeding them.
I know. It's like all of these things. And I think for that, it actually has been a very common trend. If I was to look at, like, all of these wonderful female, strong dental entrepreneur, I want to say, airway focus, that they do have this husband or this partner or whatever may be in their back that's, like, supporting them 100%, because this is a vision concept, right? You are going to be changing the lens, and with that will come obstacles and barriers, and the only thing you can have is complete undeniable trust in your gut and intuition that what you're doing is right, because you are changing the status quo. Yes, that's why, actually, now we were just talking, my husband, I'd been in this space 2025, so 2011, 15 years, and my husband now is working on light scalpel, and he's going to these conferences without me for a change, from a different perspective. And he made a really interesting kind of observation the other day. He said, I see why you guys love these conferences. It's like the only place that you can go and, like, say, hey, we're not crazy, right? Like, we
Feel
are
seen.
supported.
Yeah, you feel
Yes.
seen.
I feel you, I see you, because
How
in the
cool that
outside,
he's
for
in
the
this realm
majority
now.
of, we are still the minority, right? Like we've come so far, but we still have a way to go. And when you look at your spouses, partners, they also, if they're not in our world, they know dental from a traditional standpoint. So here it's like, hey, we had a really good thing going. Why do we got to change this? And they have to believe that it, the same thing you do, that it's, I can't do it the way I did it before. I'm a doctor or whatever I am. I took an oath to treat people and make them better than when they showed up. And I can't not tell them this. And that requires a lot of support. And I want to honor some providers that I have met recently that are just not in that space. They don't have the support at home. They have some really other heavy circumstances in their life that it's not the right time for them to dive in. And that has been why I worked really hard on, I created, I mean, I did nothing terribly special. I took what we know, the Ferris +4, which anybody has access to. But I realized just going onto that website doesn't actually allow people to know how to screen. And I took that form, I laminated it, I made a little course in patient and of me explaining how to use it as a screening tool for Philip, and I just sent it to every dentist I know, like, free, here, just learn how to screen. Just learn how to screen. I said, if you can't do anything else, just screen for it and refer out. That's it. Screen for it, refer out until the time is right. And it's amazing that since I've been giving it away with no expectations, the abundance that has returned back,
Mhm.
right? Like, because I do think in this space, we all got a little like we were holding on to the secret sauce so much. And it was because so much time and effort was put into it that sometimes just giving it away and really talking to it in a way can be very helpful. So,
Yeah.
I try now to put myself in other people's shoes more than I used to, and try to have a little bit more empathy of their circumstance, and drop seeds instead of dragging them down the road like I used
Yeah, the more complicated you make it, the more barriers there are to people, patients and providers who are asking questions. Like the more we try to hold information that should be common knowledge, but just isn't, the more harm we do to our space, because it does make it seem like, oh, you're just out for the money. Oh, you're just out for this. Really, all of us want to do is educate and help
We're
people.
like trying to spread the good word, right? Like
No,
I mean,
yeah.
all three of us have created resources to be like passing this on, right? Like I know that Liz and I, our website, we've tried so hard to create it as like a resource for people to go and get
No,
research.
your website, I want to say that I actually am in the process of doing my website, and they made me fill out all these questions, and your guys' website was the first one I put. I said, this is a website that you go to.
Those are
I
our
see,
people.
I
Mhm.
see, yeah, I see the changes you put to it. I see because I've been lucky enough, I saw, throughout its kind of progression in life,
Yeah, I've seen a
but
lot of iterations of it.
it's a work of art. It's this like testament of who you guys are and what you're building and how you're evolving. And again, like I said when you guys were on my podcast, you two are a breath of fresh air. You are a light. You both have a lot of strength and so much conviction, but you are also showing what's possible. And I think that's really amazing, and also breaking it into a really simple.
I think simple, right? Like we want to make everyone else that is interested in this journey, especially when you're talking to dentists, we want them to obviously see this, share our philosophy, treat like we do, but we want their process and their journey to be easier and condensed time for them because it took us a long time to get here. And I don't
Yeah.
think that it needed to, because we were making mistakes and figuring it out as we went. And so as we continue to evolve and continue to grow, and we will do that until the end of time, we want to hand hold and make it easier so that more patients can be seen and helped, because at the end of the day, that ripple effect is our why.
Well,
Yes.
and that's where like you saw a shortcoming in the myofunctional space and you did your ortho myo course. And how can people access that? Just so if anybody who's myofunctional is listening to this,
Yeah. So
can
the
you give us
ortho
a
myo
plug on it?
course, yeah, the ortho myo course, right now it's anybody can take it. It's on the Myo Mentor platform. That's where you can access and buy it. And it's been I appreciate you bringing that up. It's been a really, that whole project has been its like own little labor of love, because I, it was something I always wanted to do. And I was actually told not to, I was told to not do it for a while. And I'm glad that I finally pushed through. And just doing that work has actually made me realize that it's not about ortho and myo. It was the fact that I was doing myo from a very different lens, from a lens of one, highlighting the dysfunction, like knowing the structure, knowing the appliance, and just knowing how to communicate and hold a conversation about appliances already kind of puts you in a different category, right? You can call up an office, talk to an office when you can acknowledge and talk about appliances. Also, it gives a therapist or anybody insight into a little bit of the philosophy of that provider when you kind of know the why of maybe why they picked an appliance, why they're going down that particular rabbit hole. It kind of gives you a little bit of a, maybe the cliff note version of maybe what the philosophy of that office is. You can kind of see where their mindset is, depend on some of their appliances and things that they choose. But also, what it has unraveled for me, and me where I'm really passionate now about teaching and educating therapists, is about the posture and balance, right? Like everything is about balance, like life, mental, breathing, the bite, occlusion, everything's about creating symmetry and balance. And I will say, I love my myo community. We all have to start somewhere, but we got really hyper only focused on tongue clicks and right and left points. And I love that. But let's be honest, guys, we have to evolve and we have to expand and grow. And what was happening was the therapy I was doing one-on-one with patients and providers was so different than anything else anybody else was teaching, that it almost wasn't fair, right? Like, yeah, people would come, they'd have a consult with me, they'd have this really different outcome, and therapists would say, well, why is that patient look so different than the one I just worked on? And I was like, well, I did all of these other things. So ultimately, this course has become a little bit of that, a little bit of labor of love of how to treatment plan around appliances, understanding phases, activation, integration, stabilization, and bringing balance and posturing and breathing to all of it. And that's kind of what it's all been. And we're excited to see where it keeps growing and evolving. And so every time we launch it, I keep adding more and more to it.
That's awesome. I want to take it because I mean, I think that's I had to say that to a parent earlier. I go, so many times well-intentioned, because they're like, well, they had a tongue tie as a baby. And I was like, well, they still have a bilateral posterior crossbite and a tongue thrust. And they were like, well, we thought it was going to fix it. I said, well, as you're continually growing and changing, we have the nature, we have the nurture, we have the genetics, we have the environment, we have all these other compensatory factors. We have to be aware that not everything is going to be as cut and dry as right and left and clicks. Like, you have to be adaptable and understand the canvas that you're working with. So understanding the phasing from a myofunctional perspective, like, that's so incredibly impactful. And I want to take it, but I also think everybody should take it, especially if you're going to be working with orthodontists or children at all.
We're hoping that eventually it will become like just a secondary part, and we're playing with it. We're trying to find more ways so it doesn't. Sarah and I have been talking about different ways of adapting. We don't want to overwhelm every therapist from, in the beginning. It's important to learn. The tongue tie situation is such a highlight, right? Like, so the problem is, even in a 12-week myo course, every therapist, and I think you two can relate to this, will get fixated on the tongue ties, because we all want to have a solution for patients. Everybody does. Everybody wants to say, here's all the things that are wrong with you, and guess what? I can do this and you'll be better, right? I get it. I think it's an innate human way we want to handle it.
That magic bullet.
A magic bullet. So what happened is the therapist got really fixated on tongue ties, and then their providers then everyone needed a provider to do a tongue tie release, which we do. And I'd love to talk to you guys what your take on that and what you guys are going to be doing to help support that. Because right now, even in the tongue tie aspect, Myo was here way before we had people doing tongue ties. Like, you know,
For sure.
we were doing
Exactly.
therapy
That's the
before that.
treatment.
Yeah.
Exactly.
Everybody, I was actually just saying this. You go back to some of my cases, 2015 with Dr. Karen Foster. Karen was not 100% sure about tongue ties at that point. So she was like, I'm not comfortable doing these. I don't want to do it. So I have all these cases that look great. I'm like, they really needed a release. But I didn't know. We still made big moves. Then all of a sudden, Dr. Zaghi Gratitude came out 2016, 17, 18, 19. And then it was all, I mean, people were like, oh, I'm going to stop doing myo because I'm not getting a tongue tie release.
Yeah.
The pendulum went one to another. And now I feel like we're kind of leveled out, but education is an issue in that space.
Yeah. And like me, I mean, that's kind of what we talked about a little bit earlier. In terms of looking for a magic bullet, I think a lot of us as providers are also looking for that in the education space. It's like, well, I don't need to learn this because I'll just learn how to do this one thing. And I'll admit that's how I started. I was like, I'm just going to treat infants because I didn't understand all the other aspects of growth. And so I kind of like pigeonholed myself into like one little subset. And then I realized how much I was missing. And also I couldn't help the other patients coming into our practice. So that's kind of the next thing we're working on is a frenectomy course, a treatment course. We have our foundation course, which we love and we're so passionate about because I tell people you could listen to everybody's philosophies and foundation and garner information from it. Like I've taken everybody's courses. I want to keep taking all the courses that come out because we all have a little different lens we look at. One thing that I feel really passionate about is our clinical protocols. And like you said, we need a direction, we need systems. And that's kind of what we really want to help people do is systematize their treatment procedures to stay out of trouble. Of course, there's going to be nuances and decision making and things that go into the diagnostic part. But I think the procedures themselves can be more simplistic if we don't try to complicate them too much in our heads, because the anatomy is the anatomy. Just pay attention to it and know what your risks are and your red flags and case selection, and you can do a really good job in this space. So we're general restorative dentists. We love grownups. So we teach babies, littles, kids, and bigs. And we do that kind of with our restorative lens too, because so much of it is like, well, is there space to do this? What would we be doing if we were to do it? What are we hoping to gain? So that's kind of where we're.
Well, and also like, I think each piece of it coming from Liz and I, she mentioned it earlier, we're both such perfectionists. And I think that that's pretty common in our field, but like, we don't want to do something okay. And I say it all the time. We do not believe in the clip and go. Even if there's a tongue tie, in the absence of myofunctional therapy, it doesn't offer solutions. Therapy is the treatment, and you only do a release if you can't meet the objectives of myofunctional therapy. So we say that stuff all the time. And if a patient needs release and the release is going to be done, we feel very strongly that there are very specific systems and protocols that need to be followed, because we have seen, and many people have seen, horrific outcomes with lack of understanding and lack of skill to treat. It's not, it seems simple, but it's not. And so we're really excited to kind of zoom way out in our foundations course, like the why and kind of piecing it all together. And then now start to deep dive, roll up our sleeves and get into how it should be done.
Yeah.
That's amazing. So there'll actually be a clinical component. People can come, like actually hands-on come watch.
That's the plan. That's the plan.
Yeah.
So our didactic online component, because some people aren't looking to travel. I mean, when I started doing this, I think I was pregnant with a baby, and it was pre-COVID, and all sorts of stuff was going on. Like the ability to travel wasn't there. So we want accessibility, but we also we know people desire and want hands-on access.
Yeah.
Like, and I think that's the thing when we talk about like making mistakes and learning from them, like we're open books. We have done things in so many different fashions, and we have figured out ways that are more predictable, successful, systematic for people when they want to learn these protocols. So
And
I'm just really excited about the future for all of us, because I think as we go more high level, we should also take a step back and be like, it's okay to focus on the basics. It's okay to think about like what is the root of all of it. Like, for example, myofunctional therapy, more than a release. Like, forget about a tongue tie. I had a provider in town, her name was Mary Ruma Smith, and she was the best. But she retired. She goes, I've been doing myofunctional therapy for so long, and I'm just tickled that you're a female and you're a release provider. And she goes, I was treating tongue thrusts forever ago. She goes, and I would do it and it would be successful. She goes, but I had one case come back 15 years later and it relapsed. And now I know why. She goes, I couldn't believe it. There was a tongue tie. She goes, we just didn't look at it then. But you can still be successful in the myofunctional space too.
Yeah, we definitely we just continue to have, we need more options. We need more options in the general dentist space. I think a lot of general dentists need to hear from general dentists that are doing this. I think that's all, I hear that a lot from a lot of the practitioners that I'm lucky enough that I get to spend time with is, I can get their mindset right. I can get their teams to screen. I can help them support, but then they do need to be handed off to the right mentor group, right? They need the right group of their colleague, right? Of colleagues that they can relate to, that there will always be things you two can sit and talk to a group of docs that I can't, even from my outside perspective. And so having more options and opportunities to keep building and growing these groups is exactly what we need. And I think it's just a confirmation of where we're all at, is that the goal is just to keep making it a standard that every practice is screening for airway, being airway aware. They don't have to have all the they don't have to have all the systems in their office. I always just say, just become the best airway screener you can, and then see if any of the other stuff makes sense for you, right? Like,
absolutely,
where they're at.
Yeah. Well, thank you so much for your time and for all you do for our community, for patients, for providers. Like, you are a breath of fresh air. And I relate to you so much because you say Sarah's all poised. Like, look at Meggie. I mean, she looks beautiful today, as usual.
Oh, I feel like a hot mess, guys.
Oh my gosh. And then there's me. I mean, just disaster zone all the time. But my brain, it's the way it operates. So we're different people and we go together really well. But you too are a breath of fresh air. And I thank you so much for all of you do and for being so willing to share your time with us today. We got to do it again soon.
Anyone that's listening can tell that we can talk to you forever. So if you're listening and you have ideas for a conversation you'd like us to go down with Melissa, because we touched on so many things, comment, share this, spread the word. This is really fun for us, and we want to keep making it more accessible.
Yeah, let us know when the first in person is. We have plenty of people to send your way.
Oh, we've got some ideas. It's looking like March-ish.
March-ish. We love
March.
So
the didactic will be before the end of the year, and then March will be hands-on.
March-ish. Yeah.
Can't wait to see it.
Denver's a good place to visit, you guys.
Absolutely. Denver's a great place to visit. 100%.
All right. Well, love you all. And thank you so much for joining us today on No One Told Me. Share it, like it, and tell us what else you want to hear.
Awesome. Thanks, ladies. Have a great day.
Peace out, everybody.
Bye, guys.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about airway health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.